Assalamualaikum and good afternoon. So today I'll be talking about ethical reflection on a clinical case. So for introduction, the ethical issues are common in medical practice and often arise when there are conflicts between patient autonomy, beneficence, non-maleficence and justice. The following is a reflection on a clinical case I managed that involves significant ethical concerns regarding patient autonomy, informed consent, family influence, and end-of-life decision making. So for the case description, I was involved in the care of an elderly patient with advanced metastatic cancer who was admitted with worsening shortness of breath, severe pain, and poor oral intake. The patient was mentally competent and able to communicate clearly. Imaging and clinical findings indicate that disease progression despite previous treatment. During discussion about prognosis and further management, the patient expressed a wish to discontinue aggressive treatment and preferred comfort-focused care. However, several family members insisted that everything possible should be done, including escalation to intensive care and resuscitation if the patient deteriorated. The family requested that the healthcare team avoid discussing the terminal prognosis openly with the patient because they feared it will reduce hope and worsen emotional distress. This created tension between the healthcare team, the patient's expressed wishes, and the family's expectation. Several multidisciplinary discussions were conducted involving the primary medical team, palliative care specialists, nurses, and family members, and eventually, after repeated conversation and clarification of the patient's own preferences, a shared decision was made to focus on palliative management, symptom control, and dignity in end-of-life care. So the application of ethical principles were applied in this case, in which one, the autonomy, the patient wishes were ultimately respected because they had decision-making capacity. The healthcare team ensured that the patient had adequate information and opportunities to express preferences regarding treatment. 2. Beneficence. Palliative care measures were implemented to maximize comfort, including pain control, oxygen therapy, and emotional support. The focus shifted toward improving quality of life rather than prolonging life at all costs. And number 3, non-maleficence. Avoiding futile, aggressive treatment, minimize unnecessary suffering, and invasive interventions that were unlikely to provide meaningful benefit. And lastly, justice. The patient received appropriate multidisciplinary care and equitable access to palliative services. Decisions were based on clinical appropriateness and patient-centered care rather than external pressure. So in conclusion, this case highlighted the complexity of ethical decision-making in clinical practice, particularly in end-of-life care. Applying the ethical principles of autonomy, beneficence, non-maleficence, and justice help guide management and support patient-centered care. The experience reinforced the importance of communication, empathy, and professionalism in resolving ethical conflicts and provide compassionate medical care. Thank you.